Hello friends, my name is Dr. Lieutenant Colonel P. Prabhakar. I am the Associate Clinical Director and Head of the Department, Orthopaedics and Joint Replacement, Care Group of Hospitals, Nampally. Today we'll be speaking to you about knee pain with specific reference to one of the most debilitating and commonly diagnosed conditions in the elderly, which is osteoarthritis. Most commonly, all of us have heard that this particular issue is something which plagues the elderly, leading to a drastic drop in their quality of life and also impairment in terms of their functional status. So what do we do when a patient presents to us with knee pain? Now, primarily, we look at two main factors: the age of the patient. In a young patient who's presenting to us with severe wear secondary to either a post-traumatic situation, we try to see what is the primary cause of this. Now, primarily, this may also be preceding some amount of an injury, some kind of a fracture which has united or perhaps malunited and has led to early wear of the joint surface itself. More often than not, this can also be a progression of the age-related changes which follow subsequent to advancing age. All of us, by and large, are aware that this problem may later on develop into something which requires an immense amount of treatment. So when we see a patient, we want to assess the patient on two main parameters. One of them is the degree of pain, the amount of disability, which means that how often does the patient complain of inability to perform activities of daily living. Now, this may vary from individual to individual, which may include a morning walk, may include a jog in the morning, or perhaps for more active individuals, a round of golf, perhaps tennis, or any of those other sporting activities which the individual is accustomed to. In many others, it may just involve walking about within the house or perhaps walking to the neighborhood park. Whatever the treatment is, by and large, we tailor make it to suit the patient's needs. A primary clinical examination is mandatory in all patients to assess the degree of functional disability, and also basic investigations in the form of either an X-ray, which will tell us the degree of joint damage or joint reduction. This in turn tells us the amount of cartilage which is preserved or the amount of bone-on-bone contact, which means that the severe amount of cartilage damage leading to a complete wear of the joint, wherein other options of treatment perhaps need to be explored. After diagnosing what stage the patient apparently is, we go ahead with the primary forms of treatment. In cases of grade 1 to grade 2 osteoarthritis, wherein the joint space reduction is not too severe, we advise simple painkillers, which may include simple paracetamol tablets, sometimes slightly stronger ones, to help in alleviating the pain. We also encourage the patients to carry on with lifestyle modifications in terms of avoiding squatting, sitting cross-legged, which may put immense amount of pressure across the knee joint. However, in the Indian scenario, culturally as well as in religious practices, it is a standard acceptable form to either sit cross-legged, to kneel down, and so on and so forth. These, in a way, predispose to early wear of the joint surface itself. Now, this in turn, of course, leads to various other problems. These are unavoidable mostly, therefore, we do advise the patients to try to wind it up as far as possible. In cases of more advanced osteoarthritis, there are other options available, wherein there is the options of intra-articular injections, which may give a temporary relief for a brief period of time. In only majorly advanced osteoarthritis, wherein the patient is unable to perform activities of daily living and is severely debilitated because of pain and is not able to perform even basic functions of walking within the house or walking to the toilet or to the bathroom, surgical options in the form of total knee replacement are explored. Depending upon what is the level of involvement of the compartment, there are options of partial knee replacement which are available. If only primarily one single compartment of the knee is involved, we can do something which is known as a half knee replacement. This by and large is an OPD procedure in terms of literally a daycare procedure where hospitalization can be minimized to just perhaps a day. In more extensive disease, a total knee replacement is something which is advised. However, all of these decisions can be taken only after a careful evaluation of the patient, both clinically as well as radiologically, and then perhaps a specific form of treatment can be tailor-made as per the patient. Thank you all for